Welcome back to the program. Let's shift gears to marijuana. Here's what you need to know. If the legalization process goes the way the federal government hopes it does, the legislation would need to pass by the end of the week. And at that point, the federal government will be looking at some point in September for the new law to start. I don't know about you, but September's not July 1st. Is that a problem for you if the new law isn't ready July 1? Raf Souccar is the CEO of Aleafia Health. They are a leading Canadian medical marijuana company. He was previously the Deputy Commissioner of the RCMP and served on the task force that was set up by the federal government to legalize marijuana. Joins us on the line now. I appreciate your time today. Thank you very much.
Good morning, Devin, and thank you for having me on.
Well, when we look at where we are right now, who would you say is, I know it's looking like it's September, not July 1, but who's most ready to go at this point? Is it companies like yours? Is it companies with employees who they may need to have policies? Is it governments? Who do you think would be most ready to go right now if we had to?
Well, our company is ready to go for sure. Aleafia is ready to go simply because we're very medically focused, and medical cannabis has been legal in this country for over a decade. And so really there is no changes for us. We grow our cannabis, we have our own patients, we have our own clinics, and this system has, as I said, been in existence for quite some time and will continue to exist going into the future as a separate regime.
Yeah, I don't think. Sorry.
The recreational side is the one that's in limbo, if you will, with a little bit of political posturing taking place between the Senate and the government. And as you correctly pointed out, once the bill receives royal assent, it's going to take 2-3 months before implementation is actually in place.
As you've been watching this process unfold, have you been surprised that maybe it's taken a little bit longer than, I guess, the government and many Canadians may have been hoping, or is this really what we should have expected? Because it sounds as though it's, when it was first broached, people talk, oh, it's just marijuana, it's whatever, but it is a huge endeavor to get to the point where we will be in September.
You're absolutely right, Devin, and I can understand people finding that it has taken a long time. From my standpoint and from my previous life, having been involved in many, many pieces of legislation that have been brought forward, it takes a long time, and no one can ever pinpoint. And, this date of July 1st I found it very strange that there was actually a date set, because you can never predict when a piece of legislation is going to be passed. You have the legislative process that is what it is, and the debates that take place, the back and forth between the Senate and the government, the 3 readings, royal assent, and so one can never tell exactly when a piece of legislation will be passed. But all to say, they were fairly close. If it does get royal assent in the next week before the House rises, week and a half before the House rises, then they will have been fairly close in receiving royal assent. But then, of course, as I said, this becomes a start date and not an end date. So the start of getting the implementation in place.
How closely do you think other countries are watching Canada right now?
I think countries are watching Canada. We're going to be the only G7 country, if you will, the only, other than Uruguay, that will have legalized as a country. And so you see in the States, with individual states having medical cannabis legalized and other states having recreational cannabis legalized, and federally continuing to be illegal causes a problem, because you get the what they call the gray market, the interstate transportation or movement of cannabis from the legal states to the illegal states. And we're doing it as a country. We're doing it as a whole. We're doing it with provinces on side. We're doing it as I said, as a country. And I think other countries throughout the world are watching very closely how it unfolds in order to be able to copy it. And I know, Devin, from my time on the task force, that other countries were very keenly interested in how we were about to do this.
We are joined on the line by Raf Souccar, the CEO of Aleafia Health. Is September enough time to get ready, do you think, based on your experience on the task force and the questions that were being asked and issues that were being raised on the task force?
Well, I think it is. And it's not 3 months from now. It's 2 years from the time it started. So they better be ready. And they've been given all the advice, the assistance required in getting ready. There is a few bumps in the road, I guess, as we go forward. Outlets to the various provinces wanting to tweak some of the legislation, and there is room to tweak. The issue of home grow, for example, was an issue that was raised with some provinces, a couple making noise about not wanting home grow. The legislation allows for the tweaking of the home grow to allow a province to put regulations in place to ensure that it's done and done safely. What the federal government didn't want to see is the banning of home grow, which would then be very inconsistent with the legislation being put in place.
Yeah, on that point, that was interesting in the terms of the back end and the forth between the federal government and the Senate. The government generally seemed to take they said that was non-negotiable. It had to be in there. There's maybe some tweaks provinces can be making if they want, as you said. They were saying it might help against the black market. Based on your past with the RCMP, would you agree, or is that wishful thinking?
Well, the black market will, I think, react to this no different than it's reacted to contraband tobacco. Tobacco is a legal substance. As taxes go up, you see contraband tobacco then go on the rise again. So the taxation issue will have to be carefully laid out. But in terms of whether it would get the black market out of it, the black market for cannabis, I think, eventually will evaporate and move on to something else. So criminals aren't going to be put out of business. They'll just move to another commodity, to another criminal activity. But home grow should do a few things. It should prevent the criminalization of otherwise law-abiding people that just want to grow their own cannabis for various reasons, similar to making your own beer or your own wine. It displaces the black market somewhat, and the number of plants really that are going to be grown are going to be 4 or less, depending on the province. And so it's not, it's something that was debated quite strongly during our task force deliberations. And at the end, the consensus was that 4 plants was a reasonable number.
Another interesting bit of back and forth was over whether, companies can sell swag, which I guess when you think about it, if you apply it to, tobacco, you don't see a whole lot of tobacco branding out there, but it seemed like a bit of an overreach from my point of view, but where did you come on that?
So in terms of swag and advertising, there has to be, the way I see it, Devin, a balance between education, awareness, and advertising. Businesses have to be, first of all, allowed to carry on business. Bill C-45 bans advertising that and then goes on to create exceptions, such as being able to put a logo on a uniform of a salesperson working at your retail outlet, a business having letterheads, envelopes. So anything that allows you, that is reasonable and allowing you to conduct your business, as long as it's not a lifestyle advertising where they have a canoeist or a cyclist or something that may appeal to youth and attaching then cannabis to it. So as long as it's not a lifestyle promotion and it's reasonable in the carrying out of business, then it's fine. And as I said, it's a balance between education, awareness, and advertising.
All right, Raf, I certainly appreciate your time today. We'll follow this with interest.
Devin, thank you very much for having me on.
That is Raf Souccar, the CEO of Aleafia Health. We need to pause.